Namaste. Welcome to Mada. I am Chief Physician Dr. P.K. Shantakumari of Mada Ayurveda Eye Hospitals, Thiruvananthapuram. Today, I want to talk something about the Ayurvedic views about refractive errors. Because refractive errors are very common nowadays, especially among children. It starts in children from the age of 5 or 6 or 10, anyway before 15 years. So parents are more concerned about the refractive errors of their children. And they are used to ask so many questions also about that, whether there is Ayurvedic treatment for these refractive errors. Like that they are asking always. So I want to explain something about refractive errors on the basis of Ayurvedic principles and theories. Okay. Refraction means it is a deviation of light rays when it passes from one medium to another. In the eye, this refraction is the first step in the formation of visual sense. And there are 4 media in the eye in which happens this refraction. This first layer cornea, then behind that aqueous humor, then lens, and then vitreous humor. And the light rays which is reflecting from the object passes parallel in the air and reaches the cornea, first layer of the eye. And when it passes from this cornea through the different refractive media and converges on the proposed point on the retina. So the refraction should be in such a way that it should converge on retina. If there is any abnormality in this function, that means in this refraction, it develops refractive error. So normal vision is not getting. It may converge in front of the retina or beyond the retina, or it may be scattered or multifocal. Whatever may be, these are all known as refractive errors, and in all these situations, normal vision is not possible. Okay. Now, let us explain it in the Ayurvedic terms. First of all, we have to admit, or we have to keep in our mind that these structures, which is known as the fluid system or the lens, etc., we had to know that these are not non-biological or some external structures. These are biological structures in our body, and it has its own properties, its own functions, and its own metabolic activities and nourishment and nutrition, like that. So, just like any other part of our body, these structures also have biological functions. So itself, any medicine will act it. Any medicine act in these structures, and it will bring its actions also and bring normal, it can bring it to normal. So, we have to consider just like a blood or skin or any other structure. These structures also. It is not a glass piece like in our these spectacles or a fluid just like water or anything else. It is not like that. Pure biological structures made up of cells, living cells. Okay. Now when we consider this refractive media, this cornea, aqueous humor, lens, etc., these are having the predominance of Kapha. In Ayurveda, there are 3 main elements, Vata, Pitta and Kapha. And all the medicines, all the treatment procedures, all the functions, properties, everything is explained or studied on the basis of these 3 elements. Its increase, its vitiation, its abnormality, like that. So when we consider this refractive media, it is mainly having the predominance of Kapha. In Ayurveda, the term sthanic dosha will say, that means it is having the dominance, structurally it is having that dominance. And any movement or any deviation or any movement from one part to another part, one point to another point, is due to Vata. So the conduction of light rays is having the predominance of Vata. Now if you consider the light rays as such, it is having the predominance of Pitta. So the refraction and convergence on the point on the retina is due to the normal blending, normal combined working of these three factors, Vata, Pitta and Kapha. Now, any of these factors, Vata or Pitta or Kapha, is abnormal or getting vitiated, there is a chance of refractive error. So, how can we differentiate it? For the treatment also we have to decide which is the main dominant or vitiated dosha. So if there is any abnormalities in Kapha, the main symptom that anyway there will be refractive error, and the other associated symptoms may be dullness of the eye or heaviness in the eye, sometimes itching and mild headache. These may be the associated symptoms. And if the child represents these symptoms, we have to understand that there is dominance of vitiated Kapha. And if Vata is more vitiated, the child or the victim may complain sometimes pain. Pain means stretching like pain, or sometimes be squeezing his eyes while focusing on objects, or sometimes squinting of the eye. When we're focusing on an object, two eyes may not be focusing on the same point, and that is squinting of the eye, or involuntary blinking of the eyes. These are the main symptoms. So if there are these type of symptoms, we have to understand that there is vitiation of Vata. And if Pitta is more dominant means vitiated, the patient may complain some light intolerance, sometimes difficulty to face bright light, or some hot feeling in the eyes, sometimes burning sensation, sometimes redness in the eye, sometimes there will be redness of the eye even after bath. These are the symptoms. And refractive error is common in all the conditions. If associated symptoms are like this, we can have a differential diagnosis and can do treatment accordingly. And since these are all biological structures, medicine will act in these structures very successfully and will get the result. So only the point is we have to get the differential diagnosis and analyze it on the basis of Ayurveda principle. So we can start the treatment and will get the benefit also. Thank you. I am Dr. Shantakumari from Matha.